A very good morning to one and all present online, to our very excellent intellectuals, our excellency, my co-host Sana, Jansi, and all the participants here. A very good morning to all of you. Today, we are gathered here for discussing a global perspective on COVID-19. So, Sana, how different is this morning, right? All these days
Yeah,
were pretty much
all
the
these days
same.
are pretty much the same.
Exactly.
Today it's more
But
than just the usual. We are not the
we are
same.
not, the world
Hello?
has changed so much due to global pandemic, right? Pandemic, it's not just a simple word these days because it has changed so much the world.
A single touch costs a life these days, right?
Yeah, but such a condition out here is very terrific. It is terrifying, right?
I hope everybody is washing their hands and practicing social distancing.
I hope that too, Sana. Everything is reported. I mean, reportedly warnings we are getting from the government. People are taking adequate measures for safety and sanity. We can see a lot of rise in the increase in COVID-19 cases, right?
Yeah, we are having a lot
Uh,
of challenges now. Lockdown,
I know.
people suffering from corona, the quarantine, the downfall of economic, financial, mental, and physical states of people around the world.
I know, right? It is somehow impacting us mentally these days, even though we are not physically hurt. I hope everybody is okay with that to understand such a situation in a global perspective, to understand to have a different perspective on this case. We have gathered a very broad panel where we have many intellectuals who can share their opinions and views on such a condition worldwide.
Yeah.
What do you say, Sana? So, Sana, who is going to speak first today
Sir Michael
for this?
Vete from USA.
So, we welcome you to please share your opinions.
Hi, I think that you said that it was going to be me. I'm having a very difficult time actually making out what many of you are saying. So, in all honesty, I was speaking with a close colleague of mine, and she also is speaking tonight. Her name is Jean Huang, and I believe Miss Huang is actually planning on going before me, and then she'll transition into my discussion. So, I'd like to introduce Ms. Huang first to speak on her subject.
Thank you very much, Michael. Um, can everyone hear me?
Yes,
Yes, ma'am, we can hear you.
Thank you. I'm gonna share my screen. Everyone see my screen now?
Yes, ma'am, we can see the screen.
Okay.
While Jean is figuring this out, I just want to point out, again, we generally use Zoom here at UC Santa Barbara. So the software of choice that it's been forced upon us basically is the Zoom platform. So this is a brand new learning experience for both her and I. So please bear with us as we run into some technical difficulties in trying to get this to work the way we're used to.
Mr. Michael, can you hear me?
Yeah.
This is the problem with the whole world, that we were all dependent upon China, only one country. And that is why we are facing this problem, and that is why this webinar has come up, that we have to be self-reliant, self-dependent, and independent. That is why we have come up with this program today. We have to believe in ourselves now. That is the thing. Okay, please continue.
Okay. Good morning, everyone. I'm really glad to be invited to this webinar. This international webinar is I think it's a really good opportunity for people from different countries to learn from each other. So before I jump into the topic, I would like to introduce myself a little bit. I'm Jing Han. I'm from Taiwan. My education background is information management and technology management. My work experience is also a joint of technology, information, and management. I was a project manager at Dell, and also have been a product manager at Trend Micro. I'm not an expert of health or medication, but I can share my perspective as a Taiwanese and from information management point of view to share with you guys. So this is the data I got from Google yesterday. Let me see. It shows that the current cases worldwide and from country by country. Nowadays, United States has the most cases. The second place is Russia, and the United Kingdom is the third place. This is the situation now in India, and this is the situation now in Taiwan. We now have 440 cases, and it is 19 cases per 1 million people. As you can see that it is relatively really low from other countries. So nowadays we have 0 confirmed case in the past 7 days and 0 confirmed local cases in the past 32 days. Before sharing what we do in Taiwan, I would like to review some geography. This is Taiwan. We are a small island, a small country sitting next to China. We are just 200 kilometers away from China, and there are a lot of economics and travel links between these two countries. The shortest flight is not even an hour. And we have 23.8 million of people. Comparing to India, it is a really small number. But since we are just a small island, the density is really high. All I want to say is that we are in a very crowded society, and so as India, that it could be very serious and extreme in such a COVID-19 pandemic situation. So what's the situation make us doing well in these days? I will say we learned from the past that in 2003 SARS, is someone asking questions? I can barely hear. SARS killed a lot of people in 2003 in Taiwan, so our government has some experience, and since then they are more cared and paying attention about the human health and overall hygiene. So this time we can react more immediately in this crisis. Also, on the other hand, for the citizens, we are more willing to comply with the restrictions, the policies, to improve the overall human health this time. Another factor I would say is the national health care, the national health insurance in Taiwan. It is really inexpensive, it's high quality, and most importantly, it is 99.9% coverage rate. It means that almost every Taiwanese are covered and getting support by this national health insurance. And because of this, the medical database is really complete that the government can leverage the database to combat with the COVID-19. Another factor I would say is the culture, that in such a compacted society, wearing a mask is a part of our daily life. So, for example, if someone is getting flu or just have a little cold, they'll wear a mask because they don't want to infect their families, their friends, their maybe classmates or colleagues. So it is really normal for Taiwanese to wear a mask, even like in this COVID-19 situation. And the problem is how to prevent the mass panic buying of the masks. So our government banned all the mask exports to other countries, in the very beginning, the very first stage of this pandemic. Also, the government took over all the production and the distribution of the surgical masks. We put our citizens in priority. We want to protect our citizens first. And then to distribute the mask well, we use the software systems and the online mask maps to distributing the mask evenly. Other government policies such as the travel restriction, the quarantine protocols, and also everyone has to wear the masks in the public area. If you are entering like school, companies, and other buildings, shops, restaurants, there will be workers testing your body temperature to make sure you're healthy. I would say a lot of regions or countries also implemented these policies. I think what Taiwan did well this time is that the governors took decisive action really quickly to respond to the COVID-19 virus. And also, these policies are implemented really strictly, that if people don't comply with it, they'll get fined. So in the following few slides, I would say from my information management background, I think information transparency and information technology, the power is the key to the success of Taiwan to combat with the COVID-19. So these 2 points. What do I mean information transparency? Our government disclose the information very proactively. We have daily press conferences telling the citizens how many cases increased today, how many people are coming to Taiwan from other countries, and how's their result of testing, how do the policy goes, and how does the max distribution goes. And all these data and information are very transparent. I would say it is like not only educate people the right information, but also building the trust between the government and the citizens. Another thing is the information technology. Our governance, they leverage the power of big data and software applications that I mentioned earlier from the health insurance, that people can easily know that where they can buy the mask from the map, how many left, and how long they need to wait for those masks. Another thing is that the government provided a lot of epidemic prevention for dummies, something like this. It's a really easy and straightforward way to educate the citizens to do the right way. Another thing is that on the right hand side, you can see an app. We also implemented an artificial intelligence bot on the communication app called Line. Line is the most popular communication app in Taiwan. It is like the WhatsApp in India. That in this app, everyone can get the latest information, the data, the protocols, a lot of different ideas from the social app, that everyone can get the latest news. The third part of information technology, I would say, is that rather than giving the right information, identifying and clarifying the misinformation, the disinformation, and the so-called fake news is really important. So in Taiwan, we have a department called Taiwan Fact Check Center. They constantly checking the rumors and fake news online and punish those people and correct the information to the public. So I would say it is a way that can calm people down and prevent them from being panic. And it is also a good way to stabilize the overall society. So with the the policy I mentioned above. In Taiwan, we have no lockdown. The economy is fine. It got impacted, but it's fine. People are still going to school, still going to work, still going to restaurant, and even hang out with their friends. But they are really cautious about the infection and the contamination. Almost all the people are wearing masks in public. Even though we did well this time, we still have some difficulties. Taiwan is now not a member of the WHO, the World Health Organization. In the right-hand side, you can see the picture that in Hong Kong, reporter is asking the membership of Taiwan upon the WHO. And the WHO advisor pretended to have some internet bandwidth problem and refused to answer this question. That this is the difficulties that Taiwan has. And what we want to say is that Taiwan can help. We now have enough productivity and resources that we can help other countries. Like the last week, we just shipped 1 million surgical masks to India. And I would like to say that understanding and mutual assistance are stronger than fear. So I hope every country can help each other to overcome this global crisis. That's my sharing. Thank you.
Thank you, ma'am.
That was really another perspective on how this global pandemic is affecting everybody throughout the world. And I feel, other than just knowing the local news and all, we have a different view on how to solve, on how to take precautions in a wider view now. And thank you for that, Matt.